Oh my gosh, there's way more of you than that. Good morning. So much better. This feels so good to be here. I'm so happy to be here in person with you. I'm glad that I was able to be here and it was invited by Dr. Kumar. So if you haven't met me yet, just let me give you a little bit about myself. I'm 31 years in state government. I've been with the state for 31 years, started out at corrections, went to Department of Justice, and then now here in CDPH. I was an assistant deputy director in the center starting in 2018. And so then that was kind of like lifting me up into Center for Healthy Communities, worked under Monica Morales, if you guys remember Monica, and then took on the deputy director job just almost a year ago, last September, 2022. Amador County. I'm from Amador County, so my peeps, Amador County over there. Happy to see Amador County. We're small but mighty, right, Amador County? So welcome to the Oral Health Summit. I'm glad to be here giving you the opening welcome. Happy to say that I have a dentist appointment tomorrow. This is true story. My dentist retired during COVID and I loved him. And I was like, oh no, I have to find another dentist. So I'm like, 31 years will kind of tell you about how old I am. 31 years in the state government. I've only had like 2 dentists in my life. So one from when I was like baby, and then he retired, and then I got this next guy. So what was the key for looking for the new dentist? Somebody younger than me, so that I don't have to change again, right? So I know this might be embarrassing, but let me just ask, how many people had problems with pants this morning? Right? So I bought these new pants and I was like, I'm looking for them and they're not there. And my husband just took stuff to the Goodwill. And I'm like, oh shoot, I think he took those nice new pants to the Goodwill. I hope I have something else in my closet that fits. So I did okay. I know there's others. I talked to you earlier. Where's Lynn? I talked to Lynn earlier. She had some problems with pants this morning too. We're also used to wearing like these like lovely yogas or sweatpants. We look good from here up, right? I love that. Like thing about COVID. You can wear yoga pants every day. This really reminds me of when I was at the Office of Problem Gambling. We had an annual summit. I miss seeing people. I miss the connectedness. I miss being with people. So as Lindsay said earlier, take that in today, like network, take the time to be connected. We don't get that very often, and we don't get the in-person connectedness. So really take the time to enjoy that today. So Dr. Kumar asked me to focus on our Center for Healthy Communities health equity work. I am so proud of all of the things that we've done in the Center for Healthy Communities. It's so exciting that we have not looked at health equity as like this standalone thing, right? Health equity needs to be infused in all of our programs. We need to think about it all the time. We need to do it all the time. And so just talk a little bit about where we came from and where we are today. So in about 2017, 2018, we started our strategic planning. And it was our first 3-year strategic plan. We worked very closely with local health jurisdictions to come up with this shared vision for healthy and resilient communities. It was a very collaborative working relationship, and we continue that working relationship today. We're so happy to have the connections with the California Chronic Disease Leadership Partnership and with all of our LHJs throughout California. So as we were working through the first iteration, which was our first 3-year plan, we decided, health equity needs to be a focus, right? And we talked about using a health equity lens, but what does that really mean? Like we've said this for years, right? Like, oh, we're going to use a health equity lens in our programs, and we're going to develop programs with a health equity lens. But like, I was about like putting it into action, putting it into practice, right? How do we do that? And so we came up with 3 work groups. And in our second iteration of our strategic plan, we have 3 priority area work groups. And each of those priority area work groups are looking at how we actually implement health equity within our programs, giving actual resources, giving actual information, giving actual tools to all of our employees. And then, as you're going to hear through this presentation, a little bit bigger than just our CHC employees. And we were lucky enough to designate a health equity liaison within our center, which blossomed into a whole new section in our center called the Program Alignment, Communications, and Equity section. So aligning our equity communications across all of our programs in CHC. So our first, see, like up close, far away, up close, far away, right? I need those 2 different kinds of glasses. So strengthen our public health workforce. What is that work group doing? So we're working on equitable hiring practices, ensuring a diverse working workforce. We're working on recruitment and retention tools, infusing things into the process, like having a panel that is diverse, actually asking questions about health equity in interviews. We are focusing on quality improvement processes. And internally, we had training called Equity in Action, which has been a series of trainings. Many of our staff, I see Lynn shaking her head, many of our staff have been participating in these Equity in Action training sessions. So second priority, build community wealth, right? This is where we're really working with our local health jurisdictions, supporting community engagement, empowering decision-making within the communities, not the state telling people what to do, but really empowering communities to make decisions, strengthening those local partnerships, and addressing equities by really trying to direct resources, funding to the communities that are most in need. Our third work group was expand data access. And what we're doing in that work group is looking at our data gaps throughout the whole entire Center for Healthy Communities, looking at standard indicators for social determinants of health. And what is our data going to do? It's going to inform our policy, programs, and our decision making. So when you have good data, you can make good decisions. Dr. Aragon talks about, decision making intelligence. And so we're really working toward making our decisions based on data. We want to also communicate our data through a community-centric perspective. And so one of the things when I was working as an assistant deputy director, I realized is that we have amazing scientists, but a lot of times they talk scientist talk. And so when we're trying to provide health education material, it's not like, a lot of times I was reading things and I was like, I don't even get this. Like, what are we saying here? And so like thinking about the community that we're talking to, different languages, different styles, making sure that its literacy level is correct. And I'm very proud to say that this work group has developed a health equity data guidebook or a data playbook. We are just in the stages of finalizing this data playbook to talk about all of these things, to talk about standard indicators, to talk about social determinants of health. How do we look for those things? So we shared this with the rest of the department and they said, wow, Center for Healthy Communities, this is so amazing. We would love to take this and lift it up for a departmental procedure. And so Center for Healthy Communities, we are leading the way to healthy communities and safe environments for all people. And we continue to lead the way within California Department of Public Health in filling those gaps where we don't have written policies or procedures or resources that we are creating within CHC and lifting up to the whole department-wide effort. So the next thing is our equity in action. And you see, I can't read that from here because it turned out a little bit blurry with, so I'm gonna have to take a look over here. I mean, I know what equity in action is. It's amazing. It's recognition for our local health jurisdictions to be able to lift up all of the best practices that local health jurisdictions are doing in the way of equity. So we've heard over and over again that there's not a place for like sharing information, for sharing best practices. So we're building this online system where we can share information from local health jurisdictions about best practices, share tools, share, resources. It's very exciting. We had an application process where a whole bunch of local health jurisdictions submitted applications to us. We've gone through all those applications, and now we're getting ready to do our first annual recognition of local health jurisdictions. It's called Champions for Equity Recognition event. And I think I heard Lindsay say that you have a QR code that's going to link here. So if you're interested in joining us next week, there's a link on here so that you can join our Champions of Equity event to recognize all of the local health jurisdictions who have provided information to us and who have shared their health equity best practices. So what did we learn through all of this, right? As I said in the beginning, like health equity isn't just like a standalone project or its own activity. It's something really to be integrated into all of our programs and processes. And we need continuous improvement. So we don't know it all. We haven't learned it all. As Tomas would say, we're going to become the best at getting better, and continuous improvement helps us to continue to get better. So I want to leave you with this one. I found this little saying, and I think this is so true. The true measure of our success will be the number of people touched and transformed by our success, right? It's about all of the people that we touch. So with that, I just want to thank you for allowing me to be here this morning. Thank you for allowing me to get up here on stage for the first time in like 4 years. It's been really nice. I'm not behind a screen. It's great to see you all in person.